Many workers in many industries are exposed to things that can cause them harm, and health monitoring is an organised process to assess people for early changes that could be happening to them from those exposures, hopefully identify conditions at very early stages before too much harm has occurred, and it also allows feedback of information to the employer so they can perhaps introduce better controls into the workplace to prevent any injuries in the first place. The actual method of health monitoring can vary depending on the nature of the hazard. It may range from, say, hearing tests in one sphere, or it may involve a look at other organ systems in the body. Generally, it will involve some form of medical history. Also, we like to know about the role and what sort of protections the person uses in their normal work. We need to know a little bit about the likely symptoms that could be coming from the exposure. Also, in some cases, it may be necessary to do some other testing, and that could involve specialised tests like spirometry, chest x-rays, or even blood and urine tests. A site should organise health monitoring when there's a significant risk of workers being injured through an exposure to a hazardous substance. Now, that hazardous substance could appear in the schedule to the Work Health and Safety Regulation, or if it's not in that schedule, then if it's a substance that has a known harmful effect and there's a valid way of measuring for it, they should be having health monitoring. For workers exposed to silica, they definitely have a prescribed schedule for health monitoring. Workers exposed to silica will normally, once again, need a history. You want to know their general health, you want to know their workplace exposure history, you want to know what precautions are being taken. Then, because silica has its main effect on the lungs, that's where we tend to focus the bulk of the assessment. So normally you would have an examination of the respiratory tract, and then we use some specialised tests. Now, silica tends to cause inflammation and scarring in the airways, and this can change the way air flows through the lungs and also the volumes. And so we use a test called spirometry, which measures airflow and volumes in the lungs. And then with silica, we also like the person to have a chest x-ray, because that can help us to detect the early changes of scarring in the lung. The regulation actually says the employer must ensure the health monitoring is performed by a medical practitioner with experience in health monitoring. And so ideally, you should look for someone who works regularly in occupational medicine. Now, some GPs will have that experience, but many will not. So it is one area where it is important to take some care with your choice. In terms of payment, the legislation is quite clear. The employer must pay all the costs associated with the assessment. The health monitoring report should have the workers' test results, and it should explain to them what the outcome was. It should also tell them if there's a need for any further follow-up or testing, and it should also give an opinion on that worker's fitness for work and whether any forms of remediation in the workplace are necessary. The health monitoring report must be provided to the regulator when a worker has suffered an injury, illness or disease as a result of the hazard that the health monitoring report was prepared for. These reports are a personal medical record, so they are confidential, they must be stored confidentially, and they can only be released with permission from the worker. That said, the legislation does require some of the information to be released back to the employer and the regulator. You must keep the health monitoring report for a total of 30 years, and in the case of asbestos, you must keep it for 40. I'd just like to add that if you are exposing workers to hazardous substances like crystalline silica, then it is your responsibility to find out whether they require health monitoring. And if you're not sure, then please ask.